Hello there! If you've been dealing with that nagging nausea that just doesn't seem to go away, and all the tests keep coming back normal, I want you to know you've landed in the right place. Today, we're going to walk through what's going on and, more importantly, what you can do about it. So let's get started. Okay, first things first, we have to get this out of the way. Before we start, please remember that this explainer is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. It's so important to always talk to your doctor or a qualified healthcare provider about any questions you have regarding your health. I want to start by saying something that's just so important. What you are feeling is 100% real. Living with constant nausea is exhausting, especially when you're told there's nothing wrong. It's completely normal to feel frustrated, maybe even a little hopeless. But I want you to hear this. You're not alone, and there is absolutely a path forward. So here's our game plan. We're going to start with what functional nausea even is. Then we'll dive right into the practical stuff. Step 1 is all about your daily habits. Step 2 is about calming your nerves. After that, we'll look at some other helpful tools. And finally, we'll talk about your road ahead. Okay, so what in the world is actually going on in your body? The very first step to feeling better is just understanding the why. And the good news is, it's not that something is broken. It's more like there's a bit of a miscommunication happening inside. So at its heart, functional nausea is really a communication issue. Think of it like a staticky phone line between your stomach and your brain. All the parts of the phone are working just fine, but the messages are getting jumbled. And let me be really clear. This is not all in your head. It's a real physical feeling caused by mixed up signals. This communication highway even has a name. It's called the gut-brain axis. Now, with functional nausea, it's kind of like the volume knob on your stomach signals is cranked all the way up to 11. So normal little rumbles and feelings in your gut, things most people wouldn't even notice, your brain hears as a blaring alarm that says nausea. Our goal then isn't to fix something that's broken, it's just to learn how to turn that volume knob back down. All right, let's get practical. This first step is all about simple but really powerful changes you can make every single day. Think of these habits as a way to give your digestive system a much-needed break, a chance to just calm down and reset. So here are the 5 basics that really form the foundation. We're talking about eating small, frequent meals, sticking with bland, low-fat foods, sipping your drinks slowly, keeping an eye out for your personal triggers, and staying upright after you eat. Let's break a couple of these down a little more. So, why small meals? Well, think about it. A giant meal can be a shock to your system, right? But on the flip side, a totally empty stomach can also make you feel queasy. By eating smaller amounts more often, say 5 or 6 times a day, you keep your stomach from ever getting too full or too empty. It's all about finding that happy medium. And when it comes to what to eat, just think simple. Greasy, super spicy, or really rich foods are tough for your body to break down. Sticking to blander things like toast, crackers, rice, or bananas is just, it's easier on your gut. It gives your system a little vacation because it doesn't have to work so hard. Staying hydrated is so important, but how you do it really matters. If you chug a huge glass of water, you can fill up your stomach way too fast, and that alone can trigger nausea. So instead, try just sipping water or maybe some herbal tea slowly all day long. That way, you stay hydrated without overwhelming your system. Okay, on to our second big step. Remember that volume knob we talked about? Now, stress doesn't magically create nausea, but it can absolutely grab that volume knob and crank it way up. So the techniques we're about to talk about are proven ways to help turn that volume back down and calm those frantic signals between your gut and your brain. There are a few really powerful tools here. One is cognitive behavioral therapy, or CBT, which is a fancy way of saying it helps you retrain how your brain reacts to that nausea signal. Another is gut-directed hypnotherapy, which is just a very focused type of relaxation that speaks directly to that gut-brain connection. And of course, simple mindfulness and deep breathing can do wonders to calm down your body's overall stress response. Now, building those daily habits and learning to calm your nerves, those are the real cornerstones of getting better. But, sometimes you need a little extra support. So if you've tried those first 2 steps and you're still not getting enough relief, please don't get discouraged. There are other tools we can add to your plan. Your doctor might talk to you about medication, and they usually fall into a few different buckets. Some are nausea blockers that can give you some quick temporary relief. Others are what we call nerve calmers, and they work over time to quiet down those overactive gut nerves.
And sometimes medicines that help your stomach empty a bit faster can help, but this is always something you'll do very carefully with your doctor's guidance.
So, what about more natural options? Things like ginger or peppermint can be really soothing for some people, and some find relief with acupuncture. The best way to think of these is as a potential bonus to your main plan. But, and this is a big one, you have to check with your doctor before trying any new supplement, just to be sure it's safe for you.
So let's wrap this all up and talk about what happens now, your path forward. The goal here isn't about being perfect overnight. It's about making steady progress and getting back to a life that isn't ruled by the fear of feeling sick. This really hits the nail on the head. Managing functional nausea takes patience. It just does. You're going to have good days, and you're probably going to have some not so good days, and that's okay. The key is to be consistent with your new habits, be kind to yourself, and keep talking with your healthcare team so you can fine-tune the plan as you go. And really, this is what it's all about. By understanding what's happening in your body, by using these tools day in and day out, and by working as a team with your doctor, you can feel so much better. You absolutely can get back to enjoying meals, seeing friends, and just living your life. The real question isn't if you can feel better. It's which one of these steps are you going to start with today?